A lot of times the question comes up about whether or not children should be involved in euthanasia, or sometimes in general, just with end-of-life discussions. Again, lots of different factors to consider. I always say to parents or caregivers, you know your child best. So what do they already know about the illness? What is their understanding of death, if any? How do they normally cope in difficult situations? Maybe things that we talk about. I like to follow sort of this rule of thumb of if a child is able and old enough to be asked if they want to be involved, then they should be. And that doesn't mean that they're involved in sort of the nitty-gritty of everything, but we can invite children into the conversation in age-appropriate ways. And honestly, if we have the ability to prepare them for an end-of-life experience for euthanasia, then we need to take that opportunity to do so. It actually helps ease into that transition a little bit better. A lot of times, especially with school-age children, they are curious. They are going to ask questions. So what can we do? We can, give them direct and simple language. Again, phrase things so that it's age appropriate. Bring them to the vet appointment. Have them meet the veterinary team. Show how they're part of this. And a lot of times the veterinary team can work with parents to help around explanations of death and euthanasia as well. Don't be afraid to involve your children. You don't need to force them, but you don't need to hide it from them. A lot of times we want to protect our children from pain. Fair enough. Death is a painful thing. But again, when we are being dishonest with kids or when we are keeping things from them, they tend to recognize that. And we don't want them to have misinformation. We don't want them to think that they can't come and talk to the adults about these things. So as hard as it can be for you as a parent or as a caregiver, it's something that we need to consider when it comes to the end of life of our family pets.
I think it's best if most of the explanation comes from the parents for sure. But people often wonder what words to use. So I just encourage people to be really open and honest and clear. Acknowledge their emotions, really let the kids know that this is really sad and that they wish that it could be different, but that this is what needs to happen. Explain what is actually wrong with the pet and why they are dying and why it's better to let that happen sooner. And then explain that, the vets also wish we could help and that we are helping by doing this. And then I think explaining that we are going to give some special drugs to make them very sleepy, and then we will give a second injection. At that point, they will be very still and their breathing will stop and their heart will stop. And then it's going to be really calm, and we'll do our best to make it a good experience for their pet. I think most kids can understand that. I would definitely avoid the terminology put to sleep for kids because that might induce some fears of sleeping. I think using words like drugs and injections is good. I don't typically talk about needles because kids receive vaccines and things, so I want to make it clear that this is a different situation and that these are drugs that are only used for euthanasia.
Pet loss in children. My father died when I was very young. I was 5 years old. My mother had 5 girls between the ages of 4 and 12. My father had just died. Our dog, who I was particularly close to, was hit by a car and died. My mom, rather than tell me what happened, said that the dog had been taken to a farm because of the busy road and everything, had been taken to a farm and was living there. I'm going, holy jumping, that's awful. You know what, like, in my 5-year-old mind. Fast forward to, I'm probably 40 or so, and my sisters tell me that the dog had really been hit by a car. Fast forward to 2016, and Dr. Seif, who was our founder, asked me to lead a discussion of pet loss in children at a conference. It was my first year on the board, and he thought it would be a great experience and everything. Sure, I can do that. So I get up there and I'm talking about how you speak to children about pet loss and why it's always really important to be honest with them. And one of the things that you don't do is you don't tell them that the dog has gone to a farm. As I'm saying it, whack! My whole life flashed before my eyes. All of a sudden, I become that 5-year-old child, and I burst into tears. I collected my thoughts, and I went on. But when you talk about the complexity of pet loss, there are many, many layers, and people are all dealing with these things. I really think that if you can educate and bring awareness to this topic, it's really good.
Kids of all different ages think about death differently. I've had some families that will say they explained it to their 3-year-old, and then 5 minutes later they'll say, well, is he going to come home tomorrow? Their pet. And so different age groups understand things differently. But I guess the way that I would describe it, and again, different for a 3-year-old versus a 17-year-old, but Fluffy has a disease and it's making her really sick and she's going to die from that. And we want to make sure that when she dies, it's as gentle as possible and that she's not in pain during this time. And then I would potentially talk about how, remember she hasn't been eating and she doesn't want to go for a walk and, was growling when we were touching her in a certain area. And that's because she's really, really sick and we can't make her better. And so we're going to give her this special drug, which is going to get her very, very relaxed and her heart will stop and she won't wake up from that. Something like that. Obviously, if it's a teenager, then I'm going to sort of not make it as, I suppose, juvenile and just explain it a little bit clearer for them. I find sometimes with the older kids, it's not the euthanasia part, it's the aftercare part that they maybe struggle with a little bit more in understanding what happens to their body.